Good afternoon, everyone. Now we should be making a start. A warm welcome to you all, and thank you for joining us today. As always, we'll start with introductions. My name's Rob, and I'm a HR consultant for HR Solutions, and I'll be the lead presenter today. I'm joined by our operations manager, Sue, and she's here to field any technical problems that there may be. She's going to be monitoring and collating your questions, so please do send her a message if you have a question. Due to the number of attendees today, we were going to collate all of the questions and provide a summary of the questions and answers to all the attendees. We will be recording the session today, and the slides will be made available on request afterwards. Okay, so what we'll be covering today is an overview of the coronavirus COVID-19, the guide for employers, reducing the risk in the workplace. We're going to talk about employees that are returning from overseas, employees that may become unwell at work, an employee that has suspected COVID-19, an employee with a confirmed COVID-19. We'll also talk about certifying absence and sick pay, and we'll also talk about the potential need for temporary closure. The aims of today are to raise awareness of potential impact of COVID-19 in the workplace, for people to understand what the employer can do, and so people feel comfortable in managing their employees. By the end of the webinar, you will hopefully feel that we've met all of these aims. So we've all heard about the outbreak of COVID-19. The World Health Organization says about it being an illness which is generally mild, especially for children and young adults. However, it can cause serious illness, and about 1 in every 5 people who catch it need hospital care. The global number of confirmed cases of COVID-19 has surpassed 100,000. That was of 7th of March. And globally, about 3.4% of the reported cases have unfortunately died. 3.4 is the global amount. The UK government's very best assessment was that the mortality rate was 2% or likely to be lower. As of the 8th of March, there was 23,513 people tested in the UK, and 23,240 were confirmed negative, 273 were confirmed as positive. 2 patients who tested positive have unfortunately died. The situation is changing daily. The UK government has said it presents a significant challenge. They're preparing for a serious disease outbreak. There's a plan to contain it, so by detecting early cases, a plan to delay it, to slow the spread of the disease, and to push it into summer. And they also say that up to 1/5 of UK workers could be off sick at the same time. The UK government have put in a plan and calling for emergency legislation regarding sick pay and funding to the NHS, and we'll be talking about that sick pay as we go through today's webinar. There's also an expectation that in the budget on Wednesday, they will make us aware of the support there will be for small businesses. So we do advise that employers take some action to support their employees. The Health and Safety at Work Act expects you to take measures to avoid or to reduce the risk to employees. So our advice is that you keep everyone updated on the actions being taken to reduce risks of exposure in the workplace. We advise that you make sure that you've got clean places for people to wash their hands with hot water and soap, and encourage everybody to wash their hands regularly. We advise that you make sure that your managers know how to spot the symptoms of coronavirus and are clear on the sick reporting and the sick pay procedures. The symptoms being the cough, the high temperature and shortness of breath, although of course those symptoms don't mean necessarily that the person has COVID-19. We also advise that you make sure you have everybody's contact numbers and emergency contact details all up to date, should you need to be able to get hold of people. We advise that you give out hand sanitizers and tissues to staff and encourage them to use them. Also avoid bringing employees close together. It's recommended to avoid direct or close contact, that being closer than 2 meters, with any potentially infected person. So avoid big team meetings where everybody is squashed into a small place. When it comes to face masks, they're only recommended to be worn by people when they've been advised by a healthcare worker, and that's to reduce the risk of transmitting the infection to other people. And the World Health Organization advises rational use of the masks to avoid wastage. You may want to consider what roles can be worked from home and ensure that those that can take any tools home with them on a daily basis, such as laptops and such. Note that both Google and Microsoft are giving away 6 free-month tools to help people facilitate working from home. So you may have heard of Teams, you may have heard of Hangouts. These are all things that help you connect and communicate well with your employees. You may want to consider reducing face-to-face meetings and replacing them with video conference. Consider stopping all non-essential business travel or travel to an affected area. And you may want to ask employees to make you aware about non-business related travel, so their personal travel, over the next 3 months, just so you're aware if those people may need to self-isolate upon return. In addition, you may also want to consider how flexible as a company you want to be if employees want to cancel or change their holidays because of the coronavirus. It's up to you whether or not you want to allow people to cancel it, but as a business, you may want to just decide how you're going to respond to those requests when they come in. There's been lots of concern regarding people returning to the country, and we've had lots of inquiries about this and the action to take. So the UK government has split the different areas into different categories. Category 1 is areas such as China and Italy, Iran and Korea. If people have come back from those places in the last 14 days, they should self-isolate. They should call 111 online, and they should also go home or to their destination rather than coming into work. If people have come back in the last 14 days from a category 2 country, and that includes Thailand, Vietnam, Hong Kong, then they don't need to take any special measures, but if they develop any symptoms, then they should self-isolate and call 111. All other staff, though, should continue to attend work. When it comes to the category 1 and the category 2, I do advise that you check daily on the government site, because that is changing on a regular basis. If, unfortunately, an employee becomes unwell at work, then there is a need to ask them to, if someone becomes unwell in the workplace and have travelled to the affected areas, the unwell person should be removed to an area which is at least 2 meters away from other people. And if possible, you should find a room or an area where they can be isolated behind a closed door, such as a staff office. And if it's possible to open a window, do so for ventilation. And likewise, if they need to use the bathroom, it is advised, if possible, that they use a separate bathroom from other people. The employee that's unwell, they should be ringing NHS 111 from their mobile, and of course, unless they're seriously, it's an emergency, in which case they'd ring 999, and they'd need to explain to NHS 111 where they've been in the last 14 days and their current symptoms. As I said, they should remain at least 2 meters from other people. They should avoid touching people, surfaces and objects, and advised to cover their mouth and nose with a disposable tissue when they're coughing or sneezing. And as I said, if they go to the bathroom whilst waiting for medical assistance, ideally that would be an alternative. Now, if an employee has suspected COVID-19, one challenge for business is that people are likely to feel that they have the virus even when they don't and want to stay at home. But if an employee has suspected COVID-19, or even indeed a member of the public with suspected COVID-19 has been in your workplace, there is no need to close or send people home. Most possible cases turn out to be negative. Therefore, until the outcome of the test results is known, there is no action for the workplace to take at that time. So what happens if an employee has a confirmed case? Or indeed a member of the public has a confirmed case and they've been in your workplace? So closure of the workplace, again, is not recommended. The management team will be contacted by by Public Health England, the health protection team to discuss the case. So they'll contact you and they'll speak to you and identify people that have been in contact with the person with the confirmed case. They will do a risk assessment and they would understand what people they've been in contact with. They'll also be in contact with the employee directly and to advise on isolation and identifying other contacts. They'll look at who has that person been in close face-to-face touching contact with, who have they been talking with or being coughed on, anyone who has been cleaned up any bodily fluids in the workplace, anyone else in the close friendship groups or work groups, any employee living in the same household as a confirmed case. Because those people there, they'll be asked to then to self-isolate from 14 days from the last time that they had contact with the confirmed case. So then we move on to certified absence and sick pay. As you know, currently for the first 7 calendar days of absence, an employee can self-certify, and then from calendar day 8, employers need to provide a medical certificate. Now, the Health Secretary, Matt Hancock, said that the government was holding this area under review and that work was ongoing. So if people are self-certifying for 7 days, but the isolation period is recommended for 14 days, we don't want people going to their GP on calendar day 8. So what's happened is we're waiting for the government steer on this, but the government lawyers have looked at sick pay and indicated that those who self-isolate qualify immediately for statutory sick pay, and that after 7 days, employees can request a confirmation email from NHS 111 instead of a sick note from their GP. So we expect to hear about the emergency legislation within the next few days on SSP. But in the meantime, we do strongly suggest that you're very reasonable with your employees. Particularly when somebody's been advised to self-isolate due to suspected COVID-19. If an employee is actually ill because of coronavirus and they meet the SSP eligibility, then requirements they would be entitled to sick pay as always. But if you send someone home who's presenting himself fit for work, then this will be medical suspension and should be on full pay. ACAS guidelines are that if an employee has been told to self-isolate by a medical expert, then they have to go into quarantine or they're not able to return back to the UK. There is no right to sick pay, but best practice would be to pay. And as I've said, the government have recently stated that employees would be paid statutory sick pay from day 1, where before it was previously day 3. So our advice on sick pay is, as an employer, you have a duty of care towards employees, and if an employee is adamant they wish to return to work, you may decide to suspend the employee on medical grounds. We therefore advise paying sick pay for those that are self-isolating from day 1, so they don't attempt to attend work, because if they do attend work, you may then have to medically suspend them on full pay. There is, of course, more than just the legal obligations to consider. Unions have spoken out about the importance of supporting workers that self-isolate. The CIPD recommends that employers be as generous with their sick pay and leave policies as possible, both to support the staff health and well-being, but also to minimise any impact on their pay. I think we can all agree that no one should be out of pocket for doing the right thing, but do understand that they can have a huge impact on SMEs. And of course, there could be a minority of workers that lie and take advantage of the self-isolation policies, but we do advise that employers err on the side of caution and that they trust their employees. But if you trust them and then you find you have evidence on the contrary, so maybe they're not self-isolating and they're doing something other than self-isolating, then of course you would take disciplinary action. So either as a result of the disruption to your supply chain or a reduction in your customers, you may have to consider a temporary closure or reducing your workforce. If closure is necessary, there is a need for business continuity. If you have a disaster recovery plan in place, then you would follow that. But if not, there's other things to consider. So what is the most critical things that need to happen to keep the business running? What equipment do you need to ensure that the business keeps running? What can be completed at home remotely? Is it possible that somebody can work from home with a laptop? Is there some paper-based work that could be done from home? Is it possible that you could get pay-as-you-go telephones, or you have a telephone system already that could be converted to work from home? We do advise considering all those things now rather than later when it may become necessary. Also, you'd need to decide how you're going to communicate both internally to your employees, but also externally to your customers and other stakeholders. Of course, there's a need for you to update your stakeholders along the way. Another thing you may want to consider is paid annual leave. You may want to consider what your employees have currently accrued. You may want to consider what they're likely to accrue in the future, and see if people will be willing to take holiday. You may want to consider unpaid annual leave. Some employees may volunteer for this, depending on their situation. So if they do, if you speak to them about that and they do want to take some unpaid leave, just ask them to put that in writing. Of course, there is the option of enforcing holiday. So legally, you can enforce holiday by giving notice, which is twice the duration of the leave. So for example, you'd give 2 weeks notice to enforce 1 week's leave. But it's probably unlikely to be helpful in this situation, but it may be something to just be mindful of as the future goes on. Case law has found that there's a right, you need a right to deduct pay, and it needs to be in the contract. Many of you will have a layoff clause to cover this. If you contractually have the right to lay off employees, the steps to take is that first you would check to see if there's any collective or union agreement in place, and if that was the case, you would need to follow that. But in the absence of that, you would first have an informal meeting with your employee. They have no right to be accompanied. You'd explain the situation to them and the action you are taking, and then you would confirm that in writing, that you was laying that person off for a period of time. Just as a reminder, the maximum you can get if you're laid off is £29 a day for 5 days in any 3-month period. So that's a maximum of £145. If the employee usually earns less than £29 a day, they'll get the normal day rate. There is no legal limit for layoff, but an employee can claim redundancy pay after 4 continuous weeks. If you're a client of ours, we can provide written confirmation of a letter which the employee will need to take in order to claim any benefits. So that's if you do have the clause of layoff. But if you don't have the clause for layoff, you may be able to get your employees' agreement on this. My advice would be to get your employees together and explain that you need to have an emergency plan in place should you be forced to shut down. And explain that in the event that this happens, they're going to have 2 options. One is that they're going to be laid off for a period of time. They'll remain an employee. They'll continue to accrue holiday, and they'll return to work when it's deemed possible. And in that time, they'll be entitled to the statutory guarantee pay, which is the £29 I mentioned. And perhaps within that time, they could use some of their holiday as well. The other option, of course, is to be made redundant and cease to be an employee. Now, you may not, as an employer, want to go with option 2. You may not want to make any redundancies because of the cost of the recruitment and the training and get back up to speed. But if your employees don't agree to the layoff clause and you don't want to go with option 2, the only other option, if you need to close, is to pay the employee full pay. Again, with option 1, if you was to lay people off, it would be a variation to terms and conditions, and it would need to be signed so as not to breach the contract. Again, we can help you with that. Uncertainty over how long the outbreak is going to continue means employers need to protect their business in the long term. And for short service employees, those less than 2 years with their notice, you could consider a short service redundancy. So there's no statutory right to redundancy pay. However, you need to check your contracts just in case there is a redundancy payment to be made. And you may want to consider redundancies for employees with less than 2 years service. And that can be just as quick as on day one, make an announcement that you're making redundancies and the reasons why. And at the end of the announcement, handing them a letter explaining their risk of redundancy and inviting them to a consultation meeting on day 2 in order to have meaningful consultation. On day 2, you can have the meeting, take notes to make sure we catch the reasons why, also to ensure that they don't want the option of layoff as an alternative. And then if they don't, then at that point you can then make a decision to terminate and give notice. If you want to take this route, please contact us. There is a need to avoid discriminating, so we can advise on any risks with such a redundancy. For employees with over 2 years service, there would be a need to follow a full redundancy process, which again we can help you with, and depending on how many employees is the consultation period. To give it a little bit of perspective, whereabouts we are, the highest number of deaths in any one day as 108 people died, and that was back on the 10th of February 2020. However, on the same day, nearly over 26,000 people died of cancer, over 24,000 people died of heart disease, 4,300 people died of diabetes. So do advise that we keep calm and, of course, wash your hands. Again, due to the number of attendees today, we're going to collate all of your questions and provide a summary of questions and answers to all the attendees. Our current clients, please contact us in the usual way, but if you aren't a client with us already but would like to ask a question or interested in our services, then please do contact us at inquiries@hrsolutions-uk.com. This webinar and all the previous webinars are recorded and can be found on our website. And whilst the webinars are relevant at the time they're recorded, the information that is still relevant now, particularly for GDPR compliance, parental bereavement leave and pay, the recent Brexit, HR and employment law, and the future for workers. So please sign up for our webinars on the events page on either our knowledge base, if you have access to that, or on our main website. Save some dates here. For the 12th of March, we have the Good Plan Work, Contractual Changes and Implementation. Sorry, the 12th of March is IR35 Overview and HR Implications, and it's the 9th of April for the Good Work Plan. We also have some employment law seminars coming up, so save your seat. Birmingham on the 18th of March, Northampton on the 25th of March, and London on the 30th of April 2020. If you haven't already signed up for our newsletter, then this is just a reminder that you can do. Signing up will mean that you get to hear about our latest webinars and events first, and also keep abreast of any other developments. I'd like to thank you for your time today. Again, if you have any questions, please leave them and we'll come back with a response to you. Thank you.